28, 29, 30.
CPR is similar to the compression cycle for unconscious choking, but there are more compressions in each cycle, and there is no need to look for an object in the airway.
1,000, 2, 1,000, 3, 1,000.
If during your initial assessment you find that an unconscious victim does not have a pulse and is not moving or breathing, kneel next to the victim and find your hand position on the center of the chest, as you learned in unconscious choking. Position your shoulders over your hands and give 30 chest compressions.
1 and 2, 3, 4, 5, 6, 7.
Compression
8,
should be
9,
fast.
10,
30
11,
compressions
12,
should take about
13,
18
14,
seconds,
15,
about
16,
100 compressions
17,
per minute.
18, 19, 20, 21,
For an
22,
adult,
23,
compress the
24,
chest about
25,
1.5
6,
to 2
7,
inches deep.
28, 29, 30.
After 30 compressions, reposition the resuscitation mask and give 2 rescue breaths. Each breath should last about 1 second. Leave the resuscitation mask in place and quickly move back into position to
1,
begin
2,
compressions
and
again.
3, and 4,
Counting out
5,
loud helps you
6,
maintain an
7,
even
8,
pace.
and 9,
Keep your arms
10,
straight and your
11,
fingers up
12,
off the chest.
13,
The down
14,
and up motion
15,
of each
16,
compression should be a
17,
smooth
18,
motion.
19, 20,
Let the chest come
21,
all the way
22,
back up
23,
before you press down
24,
again.
25,
When you come up,
26,
don't take your
27,
hands off the
28,
chest.
29,
Just take your
30.
weight off the chest. Watch for the chest to clearly rise to make sure the breaths are effective. Once you start CPR, continue until an AED is available and ready to use, until another trained rescuer takes over, until the scene becomes unsafe, you are too exhausted to continue, or until you notice an obvious sign of life. If at any time you notice any obvious sign of life, stop CPR and monitor the victim's ABCs.
1 and
If the
2,
victim is obviously pregnant or known to be pregnant, adjust your hand position to be slightly higher on the chest and give compressions at the usual depth and rate.
If you assess a child and find no movement, breathing, or pulse, give CPR using the same technique and rate you used for an adult. Cycles of 30 compressions and 2 rescue breaths. The hand position on the center of the chest is the same. But for a child, do not compress the chest as far as for an adult. Compress the chest for a child about 1 to 1.5 inches deep. The compression rate for a child is the same as for an adult, about 100 compressions per minute. After 30 compressions, give 2 rescue breaths. Watch for the chest to clearly rise to make sure the breaths are effective. If at any time you notice an obvious sign of life, stop CPR and monitor the child's ABCs.
8 and 9 and 10 and 11 and 12 and 13 and 14 and 15.
You may also choose to give CPR for a child using the one-handed compression technique seen earlier during the unconscious choking video segment. Compression cycles and rates are the same for one-handed child CPR as they are for two-handed child CPR. 30 compressions and 2 rescue breaths per cycle at a rate of about 100 compressions per minute.
Baby, are you okay? This infant is unconscious. Call 911.
CPR for an infant is similar to a CPR for an adult and child, but uses the chest compression technique you learned for an unconscious choking infant. Keep one hand on the infant's forehead to maintain an open airway. Place 2 or 3 fingers on the center of the chest just below the nipple line. Give 30 chest compressions. Compress the chest of an infant only about 1/2 to 1 inch deep. Keep the down and up motion smooth. Let the chest come all the way back up before you press down again. When you come up, don't take your fingers off the chest, just take the pressure off the chest. The compression rate for infants is the same as the rate for adults and children, at least 100 compressions per minute. After 30 compressions, give 2 rescue breaths. Each rescue breath should last about 1 second and make the chest clearly rise.
1, 2, 3.
If at any time you notice any obvious sign of life, stop CPR and monitor the infant's ABCs.
14 and 15 and 16, 17, 18.
To review,
7, 1,000, 8,
If during the
1,000,
initial
9,
assessment
1,000,
you check
10,
an
1,000.
unconscious victim and find no movement, breathing, or pulse, begin CPR. Position your hands on the center of the chest and give 30 chest compressions.
29,
Compress
30.
the chest about 1.5 to 2 inches deep. Give 2 rescue breaths, each lasting about 1 second.
9, 1,000, 10, 1,000.
For a child, follow the same steps but compress the chest only about 1 to 1.5 inches deep.
5 and 6 and 7 and 8 and 3.
For an infant, the steps are also the same, except when giving compressions. Use one hand to keep the airway open, and with the other hand, give compressions using 2 or 3 fingers on the center of the chest just below the nipple line. Compressions for an infant should only be about 1/2 to 1 inch deep. If at any time you notice an obvious sign of life in a victim of any age, stop CPR and monitor the victim's ABCs.